I am Dr. Alison Falck. I am an assistant professor of pediatrics at University of Maryland School of Medicine in Baltimore, Maryland. This program discusses lung embryology, including a discussion of early lung embryology, the stages of lung development, development of the pulmonary vasculature, and outcomes of abnormal pulmonary development. A separate program will further detail the role of fetal lung fluid in lung development. Module 1 will focus on early lung embryology. By the end of the first module, the learner will be able to describe the early embryonic stages of normal lung development. Lung development begins from a ventral outgrowth of the embryonic foregut called the respiratory diverticulum at about week 4 of the embryonic stage. The primitive foregut is shown in gold in the figure, and the respiratory diverticulum is pictured in blue with the surrounding mesoderm shown in gray. As the respiratory tract is derived from the foregut, the epithelium of the larynx, trachea, bronchi, and lung parenchyma are endodermal in origin. However, the cartilage, muscle, blood vessels, and connective tissue of the lungs, including the parietal and visceral pleura, are derived from splanchnic mesoderm that lines the primitive foregut. The respiratory diverticulum initially develops from a midline structure within the foregut endoderm called the laryngotracheal orifice or groove. The laryngotracheal orifice is found on the ventral wall of the pharynx and is the precursor to both the larynx and the trachea. The laryngotracheal orifice is pictured in blue in figure B, surrounded by the pharyngeal arches and pharyngeal pouches shown in gold. As you may recall, the pharyngeal arches and pouches contribute structurally to the development of the face, jaw, and neck. Subsequently, the edges of the laryngotracheal orifice fuse to form the larynx and trachea cranially and the right and left mainstem bronchi caudally. The primitive respiratory tract, shown in blue in the figure, remains in communication with the pharynx via the laryngeal orifice. The respiratory diverticulum continues to elongate and branch to form the primitive lung bud. Initially, the lung bud openly communicates with the foregut in yellow. However, when the lung bud differentiates caudally, it becomes separated from the foregut by two longitudinal ridges called the tracheoesophageal ridges. These ridges eventually fuse to form the tracheoesophageal septum. The primitive foregut is then divided into a dorsal portion, the esophagus, and a ventral portion, the trachea and lung buds. This separation occurs early in the embryonic phase of fetal lung development. The lung buds continue to expand into the surrounding mesoderm. The mesoderm covering the outside of the lung develops into the visceral pleura, shown in blue. The somatic mesoderm becomes the parietal pleura, pictured in red. The lung develops in 5 stages that occur during the embryonic period and fetal period and continues following birth. Branching of the airway begins during the embryonic stage at about 4 to 6 weeks of gestation and results in 16 generations by approximately 18 weeks. Continued branching results in further differentiation into respiratory bronchioles, alveolar ducts, and alveoli by around 32 weeks gestation. Alveolarization continues until the infant reaches lung maturity. The number of distal airways increases from 65,000 at about 18 weeks to 500 times 10 to the 6th distal structures at the end of the alveolar stage. In the next module, we will cover these stages of fetal lung development in more detail. This concludes Module 1. In this module, we discuss the early embryonic stages of normal lung development. In the next module, we will discuss the 5 stages of fetal lung development. Thank you for your attention.
We would like to acknowledge the American Academy of Pediatrics, the Organization of Neonatology Training Program Directors, Neo Reviews, and Abbott Nutrition for their support of this educational program. This concludes this module.